Dear colleagues, we are very pleased to show you a very interesting case of a rare dwarfism whose prenatal ultrasonographic diagnosis has been reported in the literature only exceptionally, the Langer mesomelic dysplasia or LMD. Our group previously reported a similar case at 20 weeks ultrasound scan almost 10 years ago. LMD is generally diagnosed postnatally, and definitive diagnosis requires a molecular genetic analysis. Let's start from our second trimester ultrasound report. Let's read together. First, we report the fetus to be affected by a skeletal dysplasia, and we specify that such a skeletal dysplasia involves selectively the mesomelic limbs districts. All the four mesomelic limbs districts are involved. However, the upper limbs are more severely impaired. Indeed, there is only a single punctiform mesomelic fragment bilaterally. As a consequence, bilateral clubbing in the upper extremities is present. As regards the lower limbs, the left femur appears normal, whereas the right one is hypoplagic. There are two left mesomelic fragments and a single right mesomelic fragment. As a consequence, bilateral club feet is present too. Associated anomalies, which are typically detected in cases of LMD, are present also in our case, as you can read in the ultrasound report. A complete atrioventricular canal defect is present. The fetal nuchal thickness is increased. There is a single umbilical artery in the umbilical cord, but fetal kidneys cannot be clearly identified, although bladder filling is present. Intestinal loops appears hyperechoic and ectasic. And now, a rapid view of fetal biometries. As shown in the slide, see the yellow boxes, but the upper and the lower mesomelic limb districts appears less than the third centile. And now, before going on with the clip, we show the fetal radiographic examination after pregnancy termination, which confirms the ultrasonographic findings. In particular, note the punctiform upper mesomelic limb districts. Note also the shape of the right femur, which appears curved and hypoplagic. As brilliantly explained by Professor Canepa, whose original lesson can be found at www.fondazionecanepa.com, Langer mesomelic dysplasia is a rare subtype of a mesomelic nanism, characterized by the shortening of the middle segments of the limbs, aplasia or hypoplasia of the ulnar fibula, and variable hypoplasia of the mandible. It is caused by homozygous loss-of-function mutation in the SHOX gene, which is localized on the pseudo-autosomal region 1 of the X chromosome. And now, let's go on the video. This ultrasound scan has been performed at 20 weeks gestation. Maternal anamnesis was uneventful. Now, as you can see in the clip, a standard fetal brain anatomy survey is performed. You can see you have already seen the shape and the fetal skull, the caput septi, the midline falx, the choroid plexi, the cerebellum, cisterna magna, and nuchal fold. As you have already noted, the nuchal thickness is increased, and now we are measuring the nuchal thickness. As you can observe, it is more than 5 millimeters. Now we are observing the face of the fetus with the profile and the orbits, and then the lip, which appears all normal. A thorough evaluation of fetal anatomy is very important in differential diagnosis among the various subtypes of mesomelic dysplasia. Now we are looking at the spine, which appears normal, and the differential diagnosis, as brilliantly explained by Professor Canepa, needs a thorough evaluation of the whole fetal anatomy. Now we are looking at the abdomen. For example, regarding the spine, the Robinow syndrome is characterized by a scoliosis, which cannot be detected in our case. Now we are looking at the bladder, and we are observing a singular umbilical artery, which was another of the associated anomalies. Now we are looking at the level of the chest, at the level of the fourth chamber view, and we are looking at interventricular defect, which we are measuring now. You can also observe a atrioventricular canal. And now, beside the minor associated anomalies, now we concentrate our attention to the main condition in our case, which is the presence of a severe mesomelic dysplasia involving all the mesomelic limb districts, suggesting the lumbar mesomelic dysplasia. Now you can see the upper limbs, you can see the humerus, which is normal inside the shape. It is adhesion with a clubbed hand. At a closer look you can see a very short, a punctiform mesomelic fragment between the humerus and the hand, measuring only few millimeters. Now we are looking at the contralateral humerus, which appears normal inside the shape. Again, now we are looking at the clubbed hand and at the punctiform mesomelic fragments between the humerus and the clubbed hand. So the same dwarfing can be observed at the contralateral upper limb. There is a single left mesomelic fragment measuring 4.5 millimeters and a single right mesomelic fragment measuring 2.8 millimeters. And now let's look at the lower limbs. As you can see in the clip now, the left femur appears normal, whereas the right one is hypoplasic and curved, measuring only 12 millimeters, as shown better later. Now we are measuring the normal femurs. There are two left mesomelic fragments measuring 9.9 millimeters and 10.2 millimeters respectively. Now we are going to measure them. And there is a single right mesomelic fragment measuring only 6.9 millimeters. And now we are looking at the bilateral club fit. And we are looking at the feet now. Now, transvaginal ultrasound scan has been performed in order to confirm our findings, as well as to detect more details. The following images do not need any further comment. We suggest you to see and memorize the images for enhancing your experience. Now we are looking again at the lower limbs. And now at the feet, the clubbed feet. And now we are at the level of the hand, the feet. There is a bilateral club feet. And now we are looking at the right femurs, which appears, as already shown, curved and hypoplagic, measuring only 12 millimeters, while the contralateral femur, the left one, is normal. Now we are looking again at the feet and at mesomelic fragments. At the end of this presentation, we will show you again the radiographic examination. Radiographic examination has been analyzed in detail by Professor Canepa, which has confirmed our suggestion. Now we are looking again at the thorax at the level of the fourth chamber view. We are looking again at the atrioventricular canal defect, at the interventricular septal defect, which we are measuring again. Other associated anomalies were hyperechoic and ectasic intestinal loop, as you can see in the clip, and furthermore both fetal kidneys couldn't be clearly identified. However, as you have seen, bladder filling was present. And now you can compare ultrasonographic and radiographic details. And we thank you for your kind attention and hope that you enjoyed our work.